I would like to ask you, so what has been your experiences of working in co-production?
Well, I mean, because I'm working with the ICS, and the whole idea of the ICS is that people come together and work together across health and social care. I'm in the blessed position of working with voluntary organisations, statutory organisations, campaigning organisations, and so that's pretty much all the work that I do is around co-production, and it is about working with different groups. I've been able to bring lots of groups into the fold that have been ignored or not taken notice of for a long time. I can give you an example if you want.
Yes, please.
I work for the ICS, which is an organisation that is going to be bringing all of these different groups together, statutory, voluntary, and even some private organisations. So one of the things that I've been really proud of has been the community ambition projects that I've been working on, where we were given money from the Captain Tom Fund, about 240,000, and the idea was to address inequality by supporting organisations who were working within specific communities. So I'll give you an example. The Bangladeshi Women's Association of Essex, BWE, they've existed for 20 years. They're completely voluntary and they're completely community-led, and they've been bashing away at the healthcare services for years trying to get their views put across. So we were able to give them a grant to fund workers to do specific research within the Bangladeshi and Muslim community around all sorts of different issues. And actually, other partnership work we did was when we were doing the vaccinations, we thought that it was really important that we partnered with small community groups like that, because when we looked at the data of what was happening to those groups through COVID, they were having a much more negative experience than other communities. So for instance, the Chinese community, who were being abused in the street because everybody thought COVID was from China. So we had to make arrangements to make sure that we got them vaccinated. So the vaccination process forced us, if you like, the NHS, to work closely with some of these organisations, because we had to offer the vaccine to everybody. That included working with Refuge, the organisation for domestic violence, where women might not have been at home getting their normal letters for the doctors and their invitation to get their injections, their vaccination. So we made special arrangements for them. We made special arrangements for refugees. We made arrangements for people who didn't even have NHS numbers. So, because the idea was that we had to ask everybody. So I think that forced us, if you like, to kind of reach out and make those links. But we need to keep them now. I
really like that idea that you've actually gone to these communities, you've asked them what it is they want, and you've worked with them in that co-productive way to actually, and then you've come with funding as well to actually empower them and enable them, and the resources there ready for them to then work in co-production on how they would be able to, address any health inequalities that they've got.
That's right. And I think the other thing about when we're talking about co-production, especially when you're representing organisations as big and as huge, if you like, as the NHS, some of these smaller organisations don't have the resources to turn up to these committee meetings, to be involved. So we need to think about how we do that. Should we be giving an admin grant to organisations to make sure that they turn up to meetings and that they can partake? Because, a lot of voluntary organisations are running on 3-year funding. They're not always very well funded. So we need to think about sharing the cost of that as well.
Yeah, we often talk about that in co-production, don't we, Sue? About maybe it's not about expecting those communities to come to us and at a corporate setting and in a meeting setting that might not even be appropriate, and it's somehow being able to go to them in their setting and find ways that they can access the conversation and how they can access the co-production in that way.
Yeah, absolutely. But also there's the other thing is that, a lot of these small organisations, there has to be some equality. So if you're going to invite partner organisations in, you have to feel like they have an equal place at the table.
Yeah,
and feel valued.
Yeah, and definitely feel valued. Because, we need their expertise.
Yeah.
We need, obviously my whole thing is about people with experience. And we're all users of the NHS and social and healthcare, so we've all got a view. I don't know very many people who've got private health insurance. Some people have, but the majority of people use the NHS. In fact, I know people with private health insurance who still use the NHS. So,
yeah.